For this video, we're going to demonstrate diaphragmatic breathing or belly breathing, stacked breathing, and then I'm going to show you postural drainage for the anterior segments of the lungs. First, we're going to do stacked breathing. Sister's going to help demonstrate. So for stacked breathing, you're going to have your hands on your belly. You're going to take a long inhale in through your nose, feeling your belly rise. Push up against your hands as you inhale. So you're going to inhale through your nose. At the top of your breath, you're going to hold. Another breath in. Hold. Another breath in. Hold. And then you're going to let out all your air, making a shh sound. It's going to last at least 3 seconds. Okay? So hands on your belly. Nice inhale through your nose. Then your belly rise. Hold. Another breath in. Hold. Another breath in. Hold. And let it out. Shh. Good. That exhale needs to be about 3 seconds. So for this one, we're going to do, you want to practice it at least 2 to 3 times a day. It's good to practice it more if you're able to. It helps to expand the lungs to make them a little bit more efficient during breathing. The second time, or as you're doing it too, you might have mucus secretions. It's good to cough if you feel them coming up. So make sure there's a tissue or a trash can nearby for the patient while you're practicing this. The second one, we're going to do diaphragmatic breathing. For someone that's not familiar with it, it's best to have them lay down on their back to do it, which I'll have her do now. Go ahead and lay down on your back on the bed. You can also practice it sitting, which is a little harder to feel the belly move on sitting, or standing as well. Standing is just almost as easy as doing it in supine or laying position. So for belly breathing, you're going to have one hand on your belly and one hand on your chest, and you want nice breaths in and out, just as normal. So while you have your inhale, you're going to feel your hand on your belly rise, and your chest should stay the same. This is good to practice 3 times a day, at least 6 to 10 breaths. More if you're able to. It's really good to practice using that diaphragm to help make your lungs a little bit more efficient while you're breathing. Especially, to use the diaphragm and not the accessory muscles, which is like your neck and shoulders, to help get the lungs moving. So we're going to do this, as many times as you can a day. The next one we're doing is the postural drainage for the anterior segments. So for this one, your patient is going to be lying flat, pillows under the knees for comfort. This one out of the way, don't touch it. This one is going to help clear the anterior segments of the lungs. While you're doing this, you perform percussion. While you're performing percussion, you want to make sure that you're instructing the patient to have normal breathing as possible. Big inhales and big exhales throughout. While you're doing it, you want to make sure that if the patient has any sputum, that they have something to spit it out with, garbage can, tissue, any contraindication for this position. So while the patient is in this position, if they're increased in short of breath, dizzy, they start hypertension increase, nauseous, maybe some anxiety, stop the position, put them in an upright position or any position that makes them comfortable and feels them calm down. You can also incorporate the posture drainage positions during bathing, during maybe rotations in the bed to prevent like bed sores, or just pretty much any time of the day. You can always incorporate these. So when we're doing this, the percussion, you're going to have your hands cupped as so, just like this, and you're going to be making like a blunt kind of thumping sound. While you're doing this in this position, the hands are going to be cupped bilaterally, and it's going to be done between the clavicle and the nipple area. The rhythm is going to be about 100 to, I believe, 480 times per minute, so it's pretty fast. And yeah, you can just try this. And you basically want to try it as long as the patient is able to do it for. Another thing too, with female patients, you want to be mindful of breasts. Ask permission, for one, to make sure the patient is comfortable. And 2, you want to make sure to check if it is possible. Women that do have larger breasts, you're not able to get down to the rib portion as much, and you might be hitting more soft tissue in the ribs. So it's definitely to evaluate your patient and definitely ask for permission before you do it. My patient, demo patient here is a little bit more sensitive, so it's also and ticklish, so it's important to ask permission and be mindful while you're doing it. So again, cupping is going to be between the clavicle and nipple area, going about at least 100 times per minute. I'm going ahead and try it on my patient now. Okay. We're going to try this. Is okay? Good. Okay. Again, hands are cupped, and you want to try it just like this. Good. Just like that. She's gonna have a laughing fit, but that's okay. So this is the postural drainage for the anterior segments of the lobes.